Hey everybody, welcome back to my channel, and I am Mariana, and if you're new here, I interview the brightest minds of physical therapy. So if you want to increase your knowledge, start right now by subscribing to this channel, clicking on the bell so you don't miss anything, give us a thumbs up and share with your friends. Today, our guest is Dr. Kelly Ehlert, and she's going to talk about prenatal care and postpartum recovery. Kelly is a board-certified orthopedic clinical specialist, a certified orthopedic manual therapist, certified to treat women's health-related issues, and dry needling. Kelly has her own private practice on 𝗔𝗯cie𝘂𝘁, Tennessee, and I hope you enjoy the show. Hi, Kelly. Welcome to PT Pro Talk. How are you today?
I'm good. Thank you. Thanks for having me.
I know you're busy in your clinic, so let's get to it. So just tell us a little bit about yourself and how did you get to where you are right now?
Sure. So I'm Kelly Ehlert. I own Priority Physical Therapy. It's an out-of-network physical therapy and wellness practice in Mount Juliet, Tennessee. I started off like most people, I feel like, in the athletic world that got injured in college, had a pars fracture. For those of you who are familiar, it's a stretch fracture in the spine, and ended up, I was a college athlete, and that kind of led me down the PT route when I experienced physical therapy for myself. Came out of school and wanted to do the sports world, and did that for a little bit within a big group in Nashville with Results Physiotherapy, and had the opportunity at that time. I was in a franchise to go into the women's health world. And for me, it was one of those, like, I never thought I would do it. I didn't even know what it involved. But I noticed when I had two kids at the time that it was brought to my attention. And I noticed I had some things that I didn't know how to fix on myself. And, you know, with a doctor in physical therapy, we're supposed to be musculoskeletal experts. So if I don't know how to fix these things on myself, how can I fix them or facilitate the healing and facilitate movement within that population for my patients? So once I was introduced to some of that, it was like a whole new world opened up. And my passion now is blending the sports world and the women's health world, where, all right, now you've had a baby and you are used to being at this level of athleticism. How do you get back? Like, how do you get out of the bed and survive the first year of motherhood and then get back to what makes you feel like you and what makes you tick and what, like I love this stuff. I get so passionate because it's something that I think a lot of us aren't aware of in terms of the common myths out there of it's normal to pee when you jump and cough and laugh and sneeze. It's normal to have pain with intercourse. It's normal, like, just suck it up. And it's supposed to be like that because you're a mom. And I am not going to let that be something my patients and I believe, because personally, I've been able to battle and kind of come through a lot of those symptoms. And then I have seen too many of my patients get better and be able to get back to CrossFit or running or jumping or yes. So long story short, there's my story.
That's awesome. So I think it's very important to talk about these topics because I don't think it's very common. So let's talk about the importance of prenatal and what is the role of the PT in that process.
So I look, a lot of times we have issues that are underlying issues that when we're pregnant become more manifested because our body can't compensate as well. So what does that look like? Back pain, hip pain. I see some like SI dysfunction, pubic symphysis pain. So anything around that pelvis, knee issues, foot issues. We've got this kinetic chain that is now constantly changing with pregnancy. That is not all hormonal related. A lot of it's physiological, where we have a lot more control. There's a lot of research coming out on relaxin and how its role isn't as large as what we thought. What does that do? It puts the power back in our laps as therapists and as patients to say, look, if this is out of whack or unaligned or whatever the common term is that you kind of believe, let's get this turned back on. Let's get these muscles firing like they're supposed to. And in turn, that that reduces the pain so that you can enjoy the rest of the pregnancy, without having issues. So I see a lot of that alignment work, and I see a lot of the core just gets turned off. So like the transverse abdominis, the abdominal muscles, the diaphragm, the pelvic floor, everything gets kind of out of sync because we have some baby growing that changes our dimensions, that changes our base of support and our center of gravity, and learning how to move with our new body during pregnancy is important. And most of us, myself included, work up until the day of delivery. So we're demanding our body to do these higher level tasks, or we're still in the gym, which is great. Sometimes pain doesn't allow that. And that's where I'd love to be able to step in and offer a set of hands, and then the education that you just need to get some of those muscles woke back up, as we say, and retrain some of those things to be reciprocal again, to just work how they're, or reflexive, to work how they're supposed to.
What is the caution, or is there specific movements and that we have to avoid during this period? Because people sometimes are afraid of doing anything, of exercising. They feel that's not safe. So what do you think that changes during that period? Like, is it important to look for someone that is qualified? What are the precautions we have to take during this period in regards to the exercises and the preparation?
So we know that exercise reduces the chance, this is all research-based, exercise reduces the need for C-sections, exercise improves cardiovascular health throughout. We know that we recover better postpartum. So we watch, let's see, the symptoms that I kind of watch for, or if you're exercising or with a clinician, whether it's a chiro or a PT or a massage, or is looking for those pelvic floor symptoms. So are you feeling heaviness when you're doing an exercise or movement in the pelvic floor or belly? Do you have pain anywhere between rib cage and knees, or really anywhere in the body? Is there doming or coning? So when you look at the middle of the belly, we have the linea alba. It just connects our right abdominal muscles to the left. And naturally, 100% of us have a diastasis, have that separation during pregnancy. That's normal. We want that because our belly accommodates for baby. What we don't want is to continually load that abdominal wall in excess that can further stretch that prematurely and create more of a thinning there. So that's probably one of the biggest precautions. There's not a ton of literature on like laying flat on your back. We'll go symptom based, because that used to be do not put the patient supine, or do not put them on their back, because of the fear that the belly, the pressure of the baby, the fetus will interrupt the blood flow. So some people kind of go by they're more cautious, 20, 30 weeks, let's put them at a little bit more incline. But until that patient is super, I won't say super symptomatic, but until they have symptoms, there's no reason to not. And then if they do, you just get them off of that position. Did that answer the question?
Yeah. So I was just wondering, for example, I have a lot of friends that just got pregnant, just had the baby. So during this process, like, do you recommend everyone to look for a PT, or is there, for example, other qualified professionals that they can help during the process that are more specific to help with exercise and the precautions and all of that?
Yeah. So I work Native Pilates, and I'll just name drop a few of my favorites, just personally because of my relationships. Native Pilates is in Mount Juliet. She specializes in prenatal, postpartum Pilates and some yoga. And then Dr. Bradshaw's in Old Hickory, and he specializes as well. So he's a chiropractor. And then there's a few other like personal trainer, physical therapists in the Nashville, like Middle Tennessee area that I will refer to. Ironically, we consider like women's health a subspecialty, or like pelvic floor education a subspecialty, but 85% of women have a baby in our lifetime. And so I feel like this knowledge should be a little bit more broad than what it really is. when most of your population, if you're a clinician, is this. But I feel like there's a lot more education over the last 3 to 5 years on pelvic floor, like awareness and situation. So those of us in that niche have a lot more education and a lot more, like, we're basing things on what literature is saying. With that said, there's not a ton of literature on, like, if you run and, you know, what are your chances of having prolapse in 10 years if you run while you're pregnant? Or what are the chances of you know what I mean? There's not a lot of black and white literature for us. But there are definitely more of us who are specialized, qualified, who have a ton more hours of education, personal trainers. There are some massage therapists. Soma Wellness is in Hermitage, and Kim there is fantastic. So she does a lot of that. And then April Moore is out of Nashville, and then Erica Young, I think that's her name. My brain, she's like Brentwood, Franklin. So there's a lot of us that love that niche. You just want to find someone passionate and someone that's going to give you like legit answers and not beat around, and give you a rationale for why, and not just, well, it worked with myself or it worked on another client. Like, it needs to be, to me, a scientific as well as we can with the limited research that we have to support what the heck you're doing.
So in your experience, comparing the ones that they do the prenatal, how is their recovery postpartum with the ones, for example, that don't do anything? Because some people, they think about the postpartum, but they don't think about trying to exercise and preventing, for example, working the pelvic floor. So in your experience, how do you see these women that look for help before the birth? Do you think that impacts their recovery, or how do you see this relationship in your practice?
I think there's a huge correlation, because if we're already aware during pregnancy of what the pelvic floor is, how to relax it during childbirth, and then how to engage it, or just the core in general, I think we set ourselves up for more success, because we're already not doing the things that set us up for, I don't want to say failure, but that we know are triggers for potential irritation. And there's no reason to not do pelvic floor contractions or breath work or core abdominal contractions. Granted, that's appropriate. Now that's another soapbox, but the more you're aware of something, the better those muscles are neurologically. It's like prehab, like if you and I have treated ACLs or total knees, they go to therapy to get strong, to have the surgery to get strong. Like, you're neurologically increasing that communication between the mind and the body, that whole mind-body connection. And then, to me, the more we do that, the better we recover in the long run as well. So yeah, I've seen cool correlation there.
Absolutely, I agree 100%. And so let's talk about the postpartum now, the recovery. I know you have a recovery program. So what are the most common complaints, and how do you help these women?
Yes, so everybody's different. I will say that. Let's see, probably the most common complaints, number one, is just like the feeling, like most of the people I get, they just feel like they don't have core control. Like, I just can't connect to my abs, my back hurts. I don't feel like I can put the baby down without hurting myself, or that poor posture. They're nursing all day, so neck pain, just other orthopedic concerns you probably have heard from your buddies. And then I see a lot that just pelvic floor weakness, where they just feel like they're just not ready to go run. They just feel heavy, or they have a cough and sneeze and stuff leaks out. And then the other big concern most people have, I think, is diastasis. So that separation, because that's such a hot topic now. But I don't necessarily think it's a favorite, but one of my favorites is pain with intercourse, because there's so many things and so much, like, there's such a stigma around, like, just go back at 6 weeks and it's supposed to be fine. And there's a lot of other things that I think we need to educate our moms on, in terms of the healing process and the hormonal changes and tissue damage, and just some of the things that we don't think happen, or we forget. because baby's 6-8 weeks old and doctor's like, you're good to go. That, just needs to all be addressed. It's just learning. It's the body's a system. I feel like I just get to play. I'm like, all right, let's see if this works. Let's see if this works. And just teaching them how to move. And I think a lot of my ladies, especially early, like 4 to 8 weeks postpartum, if I have seen them before, they know how I think. Or even if they followed me on Instagram, some of them just need that permission to move. And they're so fearful, kind of like you said with the prenatal stuff, they're so fearful to make themselves have a prolapse or, and that fear manifests into more tension usually and more weakness because we're avoiding the very things that get us better. And so a lot of times it's kind of going through and dispelling those myths that we kind of breeze through, and really giving them a safe place to talk about their birth story, whether that happened how they had hoped, because I find some of that is housed as like trauma and tension in the pelvis. So giving them a safe place just to unload and whether they're happy with their doctor or not, that's part of their healing too, is kind of going through some of that piece. Yeah.
And so do you think that the patients in general and PTs, do they know about the role of the PT in this process? Like, do you think that they look as much as they should? So what do you think is missing there? And how do you think we can change this?
That's a good question, because I've asked the patients that have found me, and a lot of mine, because I am at a network, it's word of mouth. It's so-and-so said you're decent, so I wanted to come check it out, or you're good, or you know what I mean? You help so-and-so. I think it's just getting the word out and allowing people to know what the heck we actually do. You don't have to see us if you have an ankle sprain or a back pain. Like, think of us as wellness providers as well, because if, like we said, if you can go into pregnancy and postpartum with a tool bag of exercises and movement patterns and things to watch for, in the long run, we do better. And one of my big, I guess, pet peeves or passions is if I can address the little issues now in our 20s and 30s, when we're our parents' age, 50s, 60s, 70s, we can avoid so many other compensation patterns and habitual changes that just, your body is smart and it finds the least, the path of least resistance. If we can give your body the appropriate movement patterns and the appropriate just stimulus now, and then teaching those muscles to turn back on and rewiring that brain-mind-body connection, there's so much we can avoid down the road. So I don't know I think it's talking, and I've been on a couple other podcasts. It's talking at moms groups, it's talking to friends at church. It's like being real and saying, look, when I squat, I pee, or I can't bend over and touch my toes without passing gas on myself, or, and that's just the postpartum. There's endometriosis and there's bowel issues. There's so much that we can help address that doctors don't have the time for. They don't know the musculoskeletal system the same way we do. So maybe it's communicating with the doctors in that medical field as well, and getting them to understand what we do to be, I don't know, we're all passionate. We all have histories in the women's health world. And once you come see us and get comfortable, we'll tell you our own stories. But I don't know, the Instagram posts and this, and just being real about the junk that we go through as moms.
Yeah. I think it's interesting because on the podcast, every time we talk about pelvic health, it has a lot of people coming and commenting and say like, oh, thank you for talking about it, because it's not like a topic that a lot of people talk. So every now and then I like to bring someone that talks about the topic because I think it's important. And then I have friends reaching out to me because they know I am a PT, and they ask about like, oh, I need someone to help my sister that got pregnant. Do you have anyone to recommend? So I think that's nice, but I don't think it's the average population. So I think as much as we talk to our friends, and I know that you have a very active Instagram. I follow you, so your posts are very nice and informative. So I think it's just trying to share this information. So that's another goal of the podcast. And then I share with my friends, and I was like, I had my group. I had 3 or 4 friends that got pregnant last year, had the baby, and they call me, oh my God, I can't, like exactly as you said, like every time I bend forward, like my back, my lower back's killing me. What do I do? So, and I think that's very normal. We just don't talk much about it. And when you start talking to our like close group of friends and women that go through that, you see like how it is really real, and everybody passed through the same struggle. So it's just trying to make more people be aware that there is help, and there is people that are there. There are people to help you go through this phase.
And I think admitting that too, I feel like the generations prior to us brushed everything under the rug. They put their long skirts on and they tuck their squeeze their legs together and hope nothing else would happen. And our generation and behind us is different. Like, we question and we want answers, and I want you to prove and show me and tell me, and how can I, do this with your help or by myself? Like, myself as a coach.
We have access to information too. I just think about my mom. Oh my God, poor moms. They would find that information internet. It was not like a thing.
Absolutely. Yeah, I didn't think about that. Now you flip through Instagram and 50 of your friends have, pelvic whatever, workshop and trainings. And
yeah, that's awesome. So let's just transition to the final question. So what's your favorite resource of information? Any books or papers, anything that you like in particular?
I'm a nerd. I feel like I take too many courses. Like, I just finished one from the Institute for Clinical Excellence. It's the clinical management of the fitness athlete, prenatal, postpartum. And we looked at, it was an 8-week like cohort course. We did 1 hour a week online, and then together virtually like this. And then the other ones were, all the other courses were online. We had homework once a week, but we went through all of this, like, what's safe, what's not, what is research saying, what is research silent on, because we can't test on pregnant women ethically. So that has been really, really helpful. And one of the girls that actually taught the courses up in Hendersonville, so that was really cool to connect with her. She's at Onward PT. And then, so that's one of my favorite books on sex. If you wanted to get to some more like psyche and just anatomic, anatomy and education on that, to understand yourself or even your spouse, it's called Come As You Are. I think it's Emily Nagovsky. She's a sex therapist with a PhD. And that kind of helps walk you through like the accelerator system, the brake system, like how your brain and your body work, what happens through the lifespan, how some people are stimulated more than others. And then it's personally and professionally, it was one of my favorites. I'll recommend The Body Keeps Score. I can't remember who wrote that, but that talks about kind of how that trauma is sometimes housed in the body, whether it's from childhood issues or birth or a fall, and sometimes kind of digging through that. And then I just play around on Instagram too. Like, I'm like, ooh, that girl's got a fun one. Let me try that exercise. And then I'll bring it to the clinic. And I feel like I just get to play with movement patterns all day. I have my background, I'm an OCS, so clinical board certified orthopedic clinical specialist. And I have my clinical, COMT. So orthopedic manual therapist. And then I dry needle as well. So I pick pieces of yoga and Pilates and CrossFit, and I played volleyball in college, so I pull out some plyometrics, and so I kind of feel like I get to do a plethora and change it up depending on who I've got, because that's what this is all about. Like, I'm not going to throw something at you that I would my 60-year-old knee patient, or back patient or pelvic floor patient. But I have another book right here. It's called Why Pelvic Pain Hurts, and it's the neuroscience. So that's been helpful with kind of that brain and pain cycle connection that I'll rent and lease to patients.
Nice. That's plenty of information. And, and what would be the best advice you give to clinicians that are starting their careers?
Oh, expose yourself to as many different viewpoints, but pick a specific like assessment treatment lane. Like I know you're McKenzie, aren't you?
Yeah.
So I wish I had gone back. Well, I guess I could still go do it, but I went Maitland. I know Mulligan, Maitland, like there's, 30 of them that we follow, right? But I would suggest picking one kind of theoretical approach, stick with that long enough to kind of see how you're able to change patients, and then start adding bits and pieces. But always question, like there's so many other people I watch and listen to. I'm like, he's a chiro, but that's kind of PT work. But, it doesn't matter where they come from. If the scientific base is there, I feel like it's kind of fun to play off of other people's theories and stuff. But find your passion too. Yeah, I kind of went from volleyball and sports to women's health, and now I get to blend the two and help moms run again and help moms squat again. And
that's a very nice combination. So you get the two words and put them together and help them to become more active. That's very nice.
Get active.
And what personal qualities and abilities that you think are important to become a successful PT?
Oh man. I think just having the drive. Most of us are type A, right? Like do more, read more. I think not settling is important. I honestly, I actually own two businesses, a PT and then another aesthetics one. But I told my husband 3 years ago, with probably some profanity, that I would never own a business, and I do, and I absolutely love it. So maybe never say never, because I didn't ever think I would do the internal work, and I did ever think I'd own my own business, and I'm doing both, and I love it because I get to help people be them. Yes.
How crazy things are. You think you're never going to go to somewhere, and then when you see, you're there.
It's here.
Yeah, that's crazy. Well, Kelly, I really appreciate your time sharing with us all your knowledge, experience, story. And if people want to learn more about you or contact you, how they can find you.
So Priority Physical Therapy is the business. I'm in Mount Juliet. I am prioritypt.com is my website, and I.am.priority.pt are my handles for, I think, Instagram and Facebook. And I have I have one little group, but I haven't been very active on Facebook. But most of my things are on Instagram, and I'll do weekly 2-minute Tuesdays where you'll get little tidbits to try, and then just random posts for what I feel like people need to hear.
Nice. Yeah, if people want more tips, she's always posting some videos with exercise. So go there, check it out. It's fun. And Kelly, I really appreciate your taking your lunch break here to talk to me. And we can talk more about this topic and bring more awareness to PTs and to the public in general. So I really appreciate it.
Thank you. Thank you for having me. I feel like I could talk for like 3 more hours because there's so much we can run through, but that's a dip in the water for us.
Yeah, yes, exactly. I really appreciate it. Thank you.
Thank you.